Hi, it's Fran, your holistic hygienist here at Dr. Gashinsky's Holistic Dental Center, and I'm here to talk to you about something that is so exciting. We've been wanting to do this for a while because we want to help our patients as best as possible, and we now have our 3D. You can see our 3D unit here. What we do with our 3D unit, it's actually almost like an MRI, but not quite. It has 3D and 2D capabilities. What that means is 2D means like a regular X-ray. We can see the up and down and back and forth, but we can't see the depth. But with this, we can see depth. So that way we have a better diagnostic ability so that we can find things more effectively. We have more precision for surgical techniques. You have much less radiation. It's digital, so you can see an image right away. The amount of exposure is actually less than when we take even a full set of x-rays digitally. So there's so many benefits to this unit. It's unbelievable. Another great benefit is people who are claustrophobic. You can see how easy. You just step inside and the machine goes around you. There's no claustrophobic or units that you have to be rolled into or sit into. We don't have to send you to a place to get a picture taken. Dr. G can look at it and read it immediately. He can find things that we couldn't find before. There's no distortion. We have proved care. We're so excited that we can do this for our patients because we care about them so much. And then actually we have Dr. G over here looking at a picture that we just took. I'm just going to flip the watch him taking a picture. There we go. Here, hi, Dr. G. How you doing?
Great.
You must be so excited. I'm so excited. You must be incredibly excited about our new unit.
I can see everything.
Yeah,
I can see
what do we
3D
have here?
image.
Tell me what you have here.
I have a 3D image, and we're going to just show it to the big thing, that how I can see it.
Now, you showing this to patients like right away, where you're having them come back?
I'm just taking this 3D image and I study it.
Okay.
I prepare for the future surgery. It's become more predictable, much more easy for the patients, and less risky.
Fantastic.
And you know that the surgery are going so easily because we know exactly where the nerve, how much bone, how thick the bone, and where to exactly place an implant. It's unbelievable. You may look at this one, that you may see this 3D image here, this one here, and we can move it around any way we want.
Oh, look at that.
And we can see everything inside and out, and how much bone, and where is the nerve. This is the nerve coming from. And we know exactly this is the nerve. We're never going to hit the nerve because it just marked down. And it's unbelievable, that I can plan everything that needs to be done for the patient, and it's make much more secure and much more predictable procedure now.
All right, so I mean, as great as you were before, this makes you even more precise and more accurate than ever before.
This is technology.
I'm
It's
telling
allowed
you.
us to do it.
I'm telling you, this is fantastic. Now, say for instance, if I came in and I had a problem, and you took an X-ray, but you still couldn't find a complete answer, would you do something like this for me?
Yes, I would do definitely something like this for you because it's going to show me three-dimensional image.
Okay.
Because sometimes it's something overlapping. It might be not inside of your bone. It might be outside. It might be underneath of the gum. And it's going to exactly show to me where it is and how to deal with the problem.
Wow.
This image compared to panoramic X-ray does not have any change in the measurement. It's precise measurement. Because a panoramic X-ray giving 20% distortion,
really?
20% is a lot.
I would say so. You want
But
this
for
to be
this
accurate.
one, it's just very accurate. You know where the nerve is, how long the implant's gonna be, how thick his bone is, and we can go any place we need to go, and we're gonna see whereas it's moving here, how much stuff we have here, what we need to do, and we know exactly where to place an implant.
Now, I see that there's only like one small little section done. Now, I can do a small section. I don't have to do my whole mouth because I don't want a lot of radiation, say. A patient will say that. But how do you...
We choose for the patient's amount of radiation as minimum as possible.
Wow, so I
If
can do a
it's
small section like that?
Very small section. It's really very small section. It's very low radiation. And the interesting thing, we don't have to use a big protection device because the radiation goes upwards. It's not going down.
Oh, so you're saying I don't need to have an apron on?
No, there is apron that we used to have for the kids before. Now we're using these aprons for you.
So
Because radiation not going down. we don't have to worry about it. Just affect your body as much.
See, I didn't know that. That's great. Wow, because that's another concern we all have. You know, we want to minimize the amount of exposure. So I can get a great picture like this
Yes.
with a lot less exposure.
And
Wow.
also one more thing, we allow ourselves to check the quality of the unit every day. It takes us specifically 5-7 minutes, and we just calibrate it every day, make sure it's just ideal condition.
So when I'm stepping in that machine, that means
It's checked
I'm getting.
before in the
Wow.
morning, you know.
Well, that's very good to know. That's great to know because, you know, especially I know I'm going to get great service with you here, but to know that it's checked and rechecked, that all the I's are dotted and all the T's are crossed, I love it. So, Dr. G, this is fantastic. I'm so excited. I'm like a little kid in a toy store.
Me too.
I'm so this
too.
is so good. So, and I'm just going to flip this around. Anybody who's interested in finding out more about our